The healthy newborn infant born at time between 38 and 42 weeks. Between 38 and 42 weeks, cries immediately after birth, establish independent rhythmic respiration, quickly adapt with the extra uterine environment, having an average birth weight and no congenital anomalies. The period from birth to 28 days के बोला होता है neonatal period, and infant in this period is termed as neonate or newborn baby. The first week of life is known as early neonatal period. The late neonatal period extends from 7 to 28 day of age. The neonates are at risk for various health problems even though they born with average birth weight. The morbidity and mortality rate in newborn infants are high. They need optimal care for improved survival. Neonatal care is highly cost effective because saving the life of a newborn baby is associated with survival and productivity of the future adult. They constitute the foundation of life, so essential newborn care is emphasized to reduce the neonatal illness and death by preventing neonatal problem. Neonatal nurse is a key person for essential neonatal care. Assessment of neonate for early detection of problem and initiation of prompt management are the important responsibility of nursing personnel. The nurse can provide essential neonatal care in all levels of healthcare facilities with simple and low-tech measures to save the infant and give them a chance to live a full span of healthy life. Physical characteristic of healthy neonate. A healthy newborn usually has the following physical characteristic. Weight, the average weight of a normal full-term newborn. Full-term newborn infant is about 2.9 kg with a variation of 2.5 to 3.9 kg or more. The weight is very variable from country to country and in different socio-economical status. Length. At birth, the average crown heel length of the term infant is 50 cm with a range of 48 to 53 cm. The length is more reliable. Age than the weight. Healthy newborn infant. The healthy newborn infant born at a time মানে হচ্ছে between 38 to 42 weeks. Cries immediately after birth. Establish independent rhythmic respiration. Quickly adapt with the extrauterine adapt with the extrauterine environment. Having average birth weight. No congenital anomalies. The period from birth to 28 days of life called neonatal period. 0 থেকে 28 days. 0 to 28 days. Neonates বলে হচ্ছে neonates. তার মধ্যে ফার্স্ট উইক, দ্য ফার্স্ট উইক অফ লাইফ, birth to 1 week. Early neonate. 7th to 28 days. Late neonate. Physical characteristic of healthy neonates. A healthy newborn usually has the following characteristic. Weight, average weight হচ্ছে 2.5 থেকে 3.9. Weight 2.5 kg to 3.9 kg. The weight is very variable from country to country and in different socio-economical status. Length. At birth, the average crown heel length length of the term infant is 50 cm with the range of 48 থেকে 53. The length is more reliable criteria of gestational age than the weight. Length at birth, crown heel length 48 থেকে 53 centimeter. Head circumference. The head circumference is usually varies from 33 to 37 centimeter with the average of 35 centimeter. (33 to 37). Chest circumference. The chest circumference is about 3 centimeter less than head circumference. 3 centimeter less than head circumference. Other characteristic হচ্ছে the upper segment to lower segment ratio, ratio 1.8:1. The midpoint of the length or stature of the neonate lies approximately at the level of the umbilicus, insist of the symphysis pubis as in grown-up child and adult. The trunk is relatively larger and the extremities are short. Abdomen is prominent with short neck and large head. The neonate lies in a posture of partial flexion attitude as in utero. The skin is pinkish, but bluish hand and feet may present for a short time after birth. Even in normal infants, skin may be covered with vernix caseosa and lanugo hair, especially at back. The head may show molding and caput succedaneum. The ear cartilage is firm and fully carved, showing good elastic recoil. The eyes are largely covered with eyelid. The breast nodule is palpable, measuring over 5 mm in diameter. The scrotum shows adequate rugae and with deep pigmentation and palpable testes. The labia majora covered with labia minora. The sole of foot show prominent deep creases. The external auditory canal is relatively short and straight. Eardrum is thick. Eustachian tube is short and broad. The maxillary and ethmoid sinuses are small. The frontal and sphenoidal sinus are poorly developed. Kidney, liver and spleen may be palpable. Physiological characteristic. The healthy neonate cries almost immediately after birth and establishes satisfactory spontaneous respiration. The respiratory rate varies between 30 to 60 breaths per minute at resting state to crying, with an average 40 breaths per minute. The neonate can breathe both through nose and mouth. Respiration is usually periodic, shallow but irregular. It may be slow in some babies. It is usually thoraco-abdominal without any retraction and grunting. The heart rate varies between 120 to 160 beats per minute. Heart rate with an average of 140 beats per minute. It may be irregular and increase during cry and may blood pressure ranges from 60 to 80 mmHg, systolic and diastolic 25 to 40 mmHg. The normal body temperature 36.5 থেকে 37.5 which falls under but become normal within 4 to 8 hours. The cry of the newborn baby is vigorous. Rooting, sucking and swallowing reflexes are developed. Rooting, sucking and swallowing. Vigorous crying, rooting, sucking, swallowing. The newborn baby is able to take breastfeeding within 1 hour of birth and then fall asleep. A neonate spend about 80% of the time in sleeping. Demand of feeding usually established every 3 to 4 hours after 1 week. Initially feeding at irregular interval is seen. The energy requirement initially 55 calories per kg per day, which increases to 120 kilocalorie kg at the end of the first week of age. Protein and carbohydrate are efficiently digested by the newborn, but the fat is not. Limitation of anatomical structure, slow peristalsis, and imperfect control over cardiac sphincter can cause regurgitation and vomiting. The neonate loses about 7 to 8% of body weight during first week of life. The baby regain the birth weight by 10th day and then continue to gain weight about 20 to 30 gram per day for the next 3 months of age. The baby passes urine shortly after birth or within 24 hours. Some baby may pass within 48 hours. Limitation of renal function may lead to dehydration, acidosis, hyperkalemia. The fast stool or meconium is usually passed within 24 hours. It is greenish black color, thick and viscid. It is passed for first 3 to 4 days and 3 to 4 times a day. It is sterile and consists of a cast of intestinal epithelial cells, lanugo, hair, mucus, digestive juice, bile salt, bile pigment. Then the transitional stool with milk card pass for 3 to 4 days. The typical stool of a breastfeed baby may be passed after 1 week of age. It is golden yellow, soft, slight sour smell with acidic reaction. The neonate has blood volume about 80 ml per kg of body weight with RBC 6 to 8 million per mm cube. Yes, sir, markedly level poor clotting, IgG level high, IgMA negligible. T lymphocyte neurological mechanism are immature, not fully developed. Not fully developed anatomically or physiologically. Reflexes are important indicator of neurological development. Due to immature neurological development, there is labile temperature regulation, poor muscular control, and uncoordinated movement. Temperature regulation is not fully developed, heat production is low, and the infant responds readily to environmental heat and cold. Limited hepatic function lead to decreased ability to conjugate bilirubin, regulate blood glucose level and produce coagulation factor, endocrine gland and better organized than the other system. Characteristic of a healthy newborn, healthy neonate. Weight, length, head circumference, chest circumference. তারপরে হচ্ছে assessment. Assessment of newborn baby. Assessment of the newborn as soon as possible after birth and subsequent assessment in the postnatal period are vital responsibility of the nurse working in hospital or in the community. The assessment should include detailed history of prenatal, intranatal period and genetic history of family along with head to foot examination and review of maternal investigation. The purpose of initial assessment are mainly to assess the need for resuscitation to ascertain the gestational age, to detect presence of any congenital anomalies or any disorder which may affect the well-being of the baby. It should be done at the place of birth by the trained birth attendant immediately after delivery of the neonate. The assessment in the postnatal period should be done at least for 3 times, whether it may be in hospital or in home delivery. In the hospital or health center, first postnatal assessment should be done with 24-hour or next day and at the time of discharge, and the second assessment within fast postnatal Fast postnatal assessment should be done within 24 hours or next day, and at the time of discharge. And the second assessment within 2 weeks of age, and third assessment within 4 to 6 weeks of age of the baby. In home delivery, the first postnatal assessment should be done within 3 days, and other are same as institutional delivery. Mother and family members should be informed about the time of postnatal assessment, because they have to take initiative for the subsequent procedure. They should also be explained about the danger sign when the neonate need medical attention during the period. Initial assessment of neonate is a very important activity immediately after birth. The most essential assessment is the first cry. Good cry helps in establishment of satisfactory breathing. The respiration, heart rate, skin color are the basic criteria which should be evaluated immediately to determine the need for life-saving support, resuscitation. The physiological status including temperature, degree consciousness, general level of activity, gross congenital anomaly, presence of birth injury, meconium staining, and evidence of shock also need to be ascertained immediately and promptly after birth. Another significant assessment of the neonate is Apgar scoring, as described by Dr. Virginia Apgar. Despite its limitation, it is a useful quantitative assessment of the neonate condition at birth, especially for the respiratory, circulatory, and neurological status. 5 objective criteria are evaluated at 1 minute and 5 minutes. After the neonate body is completely born, the criteria respiration, heart rate per minute, muscle tone, reflex, irritability, skin color, each of these criteria is an index of neonate. Depression or lack of it at birth and is given a score of 1 or 2. The score from each of the criteria added to determine the total score. The neonate is in best possible condition if the score is 10. Score of 7 to 10 indicate neonate is the best possible condition if 10. Score is 7 to 10 indicate no difficulty in adjustment of extrauterine life. Score হচ্ছে 4 to 6 moderate difficulty in score, and if the score is 3 or below, the neonate is in severe distress which must be treated immediately. Usually neonates have lower score at 1 minute than the score at 5 minutes due to the presence of depression immediate after birth. The 5-minute score has greater predictive value since it correlates with neonatal morbidity and mortality. It also correlates more closely with the infant neurological status at 1 year of age. Significant aspect of neonatal assessment is the review of maternal and perinatal history. Detailed maternal history should include age, blood group, Rh type, chronic illness and infection, history of previous pregnancy and present pregnancy. Family history of illness and abnormal pregnancy also should be reviewed. The nurse must review the information of birth of his neonate, including gestational age, duration of labor, color of amniotic fluid, type of delivery, use of sedation or anesthesia to the mother, resuscitation required, etc. Thorough history provides useful clue to predict and anticipate problem in the newborn baby. Initial assessment also should include assessment of gestational age, measurement of birth weight, length, head circumference, chest circumference, and detailed head to foot examination to detect presence of congenital anomaly like anorectal malformation, cleft lip and palate. This assessment is usually done when the baby's condition is stable. Assessment of gestational age at birth. Assessment of gestational age is mandatory for all neonates for further management. Last menstrual period is important clue for calculation of gestational age, but it may not be reliable in menstruation irregularities or mother may not remember the exact date. The clinical assessment is more practically significant. Physical and neurological examination are done to detect the gestational maturity. Anthropometric measurement only are reliable. parameter because they may adversely affected by the intrauterine growth retardation. Hi. Apgar scoring. Respiration, heart rate, muscle tone, reflex response, or skin color. Apgar scoring. Apgar scoring হচ্ছে appearance, pulse rate, grievance. অ্যাপিয়ারেন্স হচ্ছে স্কিন কালার দেখতে হবে। অ্যাপিয়ারেন্স চেক স্কিন কালার 0, 1 আর 2। 0-তে আছে হচ্ছে পেল আর ব্লু কালার, 1-এ হচ্ছে বডি পিঙ্ক এক্সট্রিমিটি ব্লু, আর 2-এ হচ্ছে কমপ্লিটলি পিঙ্ক। P for pulse rate. Apical pulse more than 100, স্লো মানে হচ্ছে বিলো 100 আর অ্যাবসেন্ট। পি হলো, তারপর হচ্ছে জি মানে হচ্ছে গ্রিভেন্স। গ্রিভেন্স মানে হচ্ছে অ্যাক্টিভিটি রেসপন্স। গ্রিমেস। healthy newborn infant. Physical physical characteristic of healthy newborn. Physical characteristic of healthy newborn. আর কোশ্চেন আছে হচ্ছে অ্যাসেসমেন্ট newborn baby. Abgar schooling. Subsequent assessment is usually done in institutional delivery on the first day of birth within 24 hours and at the time of discharge. Daily clinical evaluation should be done between first day examination and the day of discharge, but daily detailed examination is not necessary because it may introduce infection. First day examination, it should include the following: vital sign, general behavior, posture, position, general alertness, activity, movement of limb, crying, response to stimulation, sleeping pattern. ফিডিং বিহেভিয়ার দেখতে হবে, সাকিং, সোয়ালিং রিফ্লেক্স আছে কিনা, ভমিটিং, রিজার্জিটেশন, চোকিং, ফোর্দিনেস। প্যাটার্ন অফ এলিমিনেশন, মেকোনিয়াম পাস করেছে কিনা, অ্যানোরেক্টাল ম্যালফরমেশন চেক করতে হবে। মেজারমেন্ট, gestational assessment. Assessment of gestational age can also be done on the first day if it is not done on the day of delivery or if the baby is having any problem on that day. Skin color should be examined carefully to detect cyanosis, jaundice, pallor, plethora, hair distribution, lanugo hair, burning skin, tiger, edema, ecchymosis, petechiae, erythema, toxicum, peeling, hemangiomas. Head দেখতে হবে, head should be examined for presence of caput succedaneum, cephalohematoma, molding, forceps mark, any asymmetry, encephalocelli widely separated or closely sutured, and abnormalities of fontanelle. Here is check for woolly or fuzzy or abnormal color. Face should be observed for symmetry, paralysis, shape, swelling, and abnormal movement. Eyes should be checked for edema, conjunctivitis or discharge, subconjunctival hemorrhage, color of sclera. Nose is examined for patency, low nasal breathe, nasal discharge, nasal flaring. Ear should be examined for formation of size and shape, sufficient cartilage and position. Skin tag, preauricular sinus discharge. Mouth should be checked for cleft palate in hard palate, soft palate, size of mouth cavity, oral opening, peel, frenulum lingual, tongue tie. Sucking, callocytosis, blister, oral infection. Neck should be examined for mobility, fracture, clavicle, stiffness or rigidity, hyperextension,